Dear Patriots, before the news starts, please subscribe to our patriotic channel by clicking the subscribe button. Give us a thumbs up to this video. Don't forget to leave your opinion below in the comments section. Share the news on Facebook and Twitter so you friends see it. Thank you.
Bill Gates: I don't agree with Trump's America First rhetoric. Microsoft founder and philanthropist Bill Gates said Thursday that he does not see eye to eye with President Donald Trump's America First approach to foreign aid, but will try in his White House meeting with the president to convince him that continuing such global spending is in the nation's best interests. Gates is scheduled to meet with the president Thursday afternoon in the Oval Office, where he said he will tailor his pitch on continued foreign aid spending to Trump's worldview. "Yeah, I don't agree with the American First rhetoric. That is, I think the alliances that we've built over time and the help we've provided to countries uplifting them, have made the world a more stable, a richer place," Gates said in an interview with Politico Playbook authors Anna Palmer and Jake Sherman. "I'll take his framework and explain why things like health security and continued foreign aid, even in that narrow framework, where you give no credit for saving lives in Africa, kind of pure humanitarian things, even without that, this is money well spent," he added later. As part of the president's broader America First agenda, the Trump administration has proposed significant cuts to the amount of foreign aid the U.S. doles out around the globe, suggesting that those taxpayer dollars would be better spent at home. Trump has long insisted that the U.S. spends too much on supporting other nations while Americans who could also benefit from government spending languish. Gates, who along with his wife has given away $28 billion through the foundation they oversee, rejected the notion that the Trump administration's reduction in foreign aid might spur other nations to do more, remarking that "It's hard for me to understand the notion that helping people that are poorer than we are is a bad thing. It's kind of in the Bible." Thursday morning, Gates argued the case that aside from humanitarian benefits, U.S. foreign aid can promote the stability of foreign governments and prevent health crises with the potential to spread to the U.S. Americans feel much warmer toward foreign aid, he said, when they connect it to specifics like combating HIV. Gates said his message to Trump will be twofold: that foreign aid, which makes up less than 1% of the federal budget, has already proven beneficial to U.S. interests, and that a sliver of the increased spending in the upcoming budget dedicated toward readiness for a pandemic could work wonders for national health security. "The preparedness we have for a pandemic, either a naturally caused pandemic or a bioterrorism, intention-caused pandemic, we don't have the tools, the preparedness, the capacity to deal with that," he said. And yet the science is at a point where for a fairly small portion of that increase, say a few percent a year, you could do something quite miraculous in terms of health security. On the global stage, Gates said America's step back from certain forums on the world stage has the potential to prove problematic because it creates a vacuum of leadership that people badly miss. Still, he predicted that Trump's interest in leadership and breaking new ground on difficult issues might open an avenue by which the president could be persuaded that supporting future foreign aid could bear fruit for his administration. "In business, you meet a lot of different kinds of people, and you have to be good at adapting to different styles of working. I wasn't in the New York real estate business or the New Jersey casino business, and obviously I missed a whole different approach," Gates said. White House's Sanders calls FBI Deputy Director a bad actor. White House Press Secretary Sarah Huckabee Sanders said Thursday that the Trump administration believes FBI Deputy Director Andrew McCabe is by most accounts a bad actor, but stopped short of calling for his firing, telling reporters that decision should be made by Attorney General Jeff Sessions. "That's a determination that we would leave up to Attorney General Sessions," Sanders said. "But we do think it is well documented that he has had some very troubling behavior and by most accounts a bad actor and should have some cause for concern." Reports that Sessions was considering firing McCabe surfaced this week, due to a yet-to-be-released watchdog report that reportedly says the deputy director was not forthcoming in a review by the Justice Department's Inspector General. McCabe, who has been a frequent target of criticism from President Donald Trump, announced in January that he would retire, using up his accumulated leave before officially leaving the bureau at the end of this week. Should Sessions fire him before Sunday, McCabe would not receive the pension benefits for which he is currently eligible. Trump has accused the deputy FBI director of bias because his wife ran for a seat in 2015 in Virginia's legislature and received donations from the Political Action Committee of then-Governor Terry McAuliffe, a Democrat and close ally of Hillary Clinton. McCabe did not rise to the level of deputy director until after his wife's election loss, and it was former FBI Director James Comey, not McCabe, who decided against recommending Clinton face charges over her use of a private email system when she was Secretary of State. Exclusive Trump finalizing opioid plan that includes death penalty for dealers. The Trump administration is finalizing a long-awaited plan that it says will solve the opioid crisis, but it also calls for law enforcement measures, like the death penalty for some drug dealers, that public health advocates and congressional Republicans warn will detract from efforts to reverse the epidemic. The ambitious plan, which the White House has quietly been circulating among political appointees this month, could be announced as soon as Monday when President Donald Trump visits New Hampshire, a state hard hit by the epidemic. It includes a mix of prevention and treatment measures that advocates have long endorsed, as well as beefed up enforcement in line with the president's frequent calls for a harsh crackdown on drug traffickers and dealers. The White House's most concrete proposal yet to address opioids comes after complaints from state health officials and advocates that Trump has moved too slowly to combat the epidemic after his bold campaign promises to wipe out the crisis touching all parts of the country. However, the plan could cost billions of dollars more than Trump budgeted, and likely far more than any funding package that Congress would approve, raising questions about how much of it can actually be put into practice. Trump's emphatic embrace of the death penalty for some drug dealers has also alarmed some advocates, who say the idea has been ineffective when tried in other countries and resurrects the nation's unsuccessful war on drugs. Under the most recent version of the plan, which has gone through several revisions, the Trump administration proposes to change how the government pays for opioid prescriptions to limit access to powerful painkillers. It also calls on Congress to change how Medicaid pays for treatment, seeking to make it easier for patients with addictions to get inpatient care. It would also create a new Justice Department task force that more aggressively monitors internet sales. The administration claims its plan will reduce opioid prescriptions by 1/3 within 3 years and that the initiative will fulfill Trump's campaign promise to stop opioid abuse. However, that will be a tall order. There were more than 64,000 drug overdose deaths in 2016, mostly involving opioids, according to the most recent federal mortality data. The CDC last week reported that emergency rooms recorded a 30% spike in opioid overdoses last summer, indicating that the devastating crisis is worsening. Politico obtained 2 versions of the White House plan and spoke with 4 individuals who have reviewed it. The White House confirmed that a plan was in development but didn't respond to multiple requests for further comment. Many of the measures in the plan were recommended by the President's Opioids Commission last fall or discussed at a March 1 White House Opioid Summit. For instance, it endorses a long-promised priority, greatly expanding first responders' access to naloxone, a medication used to reverse opioid overdoses. It also calls on states to adopt a prescription drug monitoring database that healthcare providers can access nationwide to flag patients seeking out numerous opioid prescriptions. On the policing side, the plan would ramp up prosecution and punishment, underscoring the tension in how public health advocates and law enforcement officials approach the crisis. Public health advocates say the nation's opioid epidemic should be treated as a disease, with emphasis on boosting underfunded treatment and prevention programs. But some law enforcement officials back tougher punishments as a deterrent, especially for drug dealers. The two camps don't always see eye to eye, at times pitting HHS and DOJ officials against each other. There is a lot of internal dissension between the health folks and the enforcement folks, said an official involved in the crafting of the plan. While Trump this month repeatedly suggested using the death penalty to deter drug dealers and traffickers, an idea roundly opposed by public health advocates, many lawmakers have said they weren't sure whether to take the idea seriously. "I would have to strongly evaluate and look at any proposal like that," said Senator Dan Sullivan, Republican Alaska, on Wednesday. "I don't know if the president was serious or just said it off the cuff. It's a big issue when you decide to bring a capital case or pass a law that allows for capital punishment." According to language circulating this week, the Trump administration will call for the death penalty as an option in certain cases where opioid, including fentanyl-related, drug dealing and trafficking are directly responsible for death. Senator Shelley Moore Capito, R.W. Virginia, whose home state is one of the hardest hit by the opioid epidemic, said she doesn't support the death penalty for drug cases. "I mean, I get the message he's delivering, we've got to treat it seriously," she said. "I don't see that that's going to solve the problem." The White House plan also calls for making it easier to invoke the mandatory minimum sentence for drug traffickers who knowingly distribute illegal opioids that can be lethal, like fentanyl. It also proposes a new Justice Department task force known as Prescription Interdiction and Litigation, or PIL, which would be empowered to step up prosecutions of criminally negligent doctors, pharmacies and other providers. The White House is also backing new health ideas, such as calling for 75% of opioid prescriptions reimbursed by government health programs like Medicare and Medicaid to be issued by using best practices within 3 years. That would be scaled up to 95% of prescriptions in 5 years. It also calls on Congress to formally repeal a rule barring Medicaid payment to residential treatment for opioid addiction at large facilities, which could cost tens of billions of dollars. The rule, implemented about 50 years ago, was meant to discourage mass institutionalization of people with mental illness, but states say it has been a barrier to addiction treatment. Some states under the Obama and Trump administrations have received federal permission to waive the rule for substance abuse treatment. The plan also includes measures favored by progressive drug policy reformers like changing the nation's prison system so all federal inmates would be screened for opioid use upon arrival and steered toward treatment at residential reentry centers as necessary. It also calls for improving tracking systems to rapidly steer resources to areas struggling with the opioid epidemic. Trump could announce the plan, or aspects of it, on Monday, when he is scheduled to return to New Hampshire with HHS Secretary Alex Azar. It will be Trump's first trip to New Hampshire as president after numerous campaign trips to the state to highlight the opioid epidemic. Some administration officials hope to announce the long-developing opioid plan, including the death penalty for drug dealers, at the March 1 opioid summit, but it wasn't ready in time. However, Trump still riffed that day about the need to use the death penalty to fight the opioid epidemic. "If you shoot one person, they give you life, they give you the death penalty," Trump said at the time. "These people can kill 2,000, 3,000 people and nothing happens to them." Brianna Ely, Sarah Carlin Smith and Adam Cancun contributed to this report. Trump's FDA weighs nicotine limits in cigarettes. The FDA is considering setting a maximum nicotine level in cigarettes for the first time to make them less addictive and is seeking public feedback ahead of issuing a proposed rule. Lowering nicotine levels will make it harder for future generations to become dependent on cigarettes and make it easier for current smokers to quit or switch to less harmful products, Commissioner Scott Gottlieb said in a statement. The agency is seeking public comment on the proposal. "There is no other single action our country can take that would prevent more young people from smoking or save more lives," Matthew Myers, president of the Campaign for Tobacco-Free Kids, said in a statement. "This is truly a once-in-a-lifetime opportunity to greatly accelerate progress in reducing tobacco use, the nation's #1 cause of preventable death, and bring us closer to eliminating the death and disease it causes." The nicotine rule is one of a number of tobacco-related regulations FDA is working on. The agency will soon seek comment on the role that flavors like menthol play in tobacco use, and to get feedback and data concerning the possible regulation of premium cigars. It's also working to modernize its approach to the development and regulation of nicotine replacement products like gum and patches. Combined, the moves bring tobacco regulation to a prominence not seen since the tenure of David Kessler, who led the agency during the George H.W. Bush and Clinton administrations. On the nicotine limit, the FDA also is seeking comment on whether a maximum level should be implemented at once or gradually. And it wants to know about unintended consequences, such as the potential for an illicit cigarette market. The FDA was given the authority to regulate nicotine levels under the 2009 Tobacco Control Act. Lowering levels in cigarettes is now more workable, Kessler told Politico, because of the availability of electronic cigarettes and other alternatives. There is a grand bargain here ultimately, Kessler said. We have to end cigarettes as we know it. That will save hundreds of thousands of lives and also give people who are addicted appropriate ways to reduce their harm and not force them to the black market. The challenge, he said, will be to provide alternatives for those who need them without encouraging young people to become addicted to nicotine through these alternatives. The FDA said it is particularly interested in comments about the merits of nicotine levels at 0.3, 0.4 and 0.5 milligrams of nicotine per gram of tobacco filler, in an advance notice of proposed rulemaking issued this morning. A 2013 survey paper estimated that reducing total nicotine content of cigarettes to 0.5 milligrams per cigarette would minimize addictiveness, but new data indicate the level may need to be lower. Tobacco use, primarily from cigarettes, kills more than 480,000 Americans every year, costing the country nearly $300 billion in direct health care costs and lost productivity, FDA said. The FDA cited a New England Journal of Medicine analysis that lowering nicotine levels could cause about 5 million more adult smokers to quit within 1 year of implementation. By 2100, the analysis estimates more than 33 million people would have avoided becoming regular smokers, leading to more than 8 million fewer tobacco-related deaths.